Hello and welcome to Lynchburg Live. I'm your host, Linda Smith. Each year, thousands of women in the United States are diagnosed with ovarian cancer. All women are at risk for ovarian cancer, but older women are more at risk. But that does not mean that younger women do not get this disease. My guest tonight is Danelle Clark, a young ovarian cancer survivor diagnosed in her early 20s, which just indicates that this disease can and does victimize younger women as well. Danelle, welcome to Lynchburg Live.
Thank you so much, Linda.
You know, as we get started, would you tell us a little bit about your life before you were diagnosed with ovarian cancer?
I just was a regular 20-year-old, and I was working as the sous chef at the Devil's Backbone Brewing Company and working a lot of hours and you know, just getting by. Basically enjoying life.
Enjoying your 20-year-old
yeah.
life. So it was 20 that you were diagnosed?
It was 23.
23.
So,
yeah. You know, for those people in our audience, I know that everybody's heard about ovarian cancer, but they probably don't know what it is. Can you sort of tell us what it is?
Yeah. Ovarian cancer is when malignant cells are found in the tissue of one or both of the ovaries, and the ovaries are part of the female reproductive system, and they create hormones and release eggs. So.
And you were diagnosed in 23, very, very young for this.
It is very young for ovarian cancer. Typically, it is found in women who are 55 or older. So to be 23 is very young.
So you find it in older women more. Do you also find it in a specific ethnic group, or is it just because you're a woman?
I think it shows up in old Jewish ethnicity a lot, but it can be any woman, any age.
Right.
So
it's just like breast cancer or any of the reproductive cancers in women. Your greatest risk is the fact that you're a woman.
Mm-hmm.
And you know, there's a bond there among women because of that, I think.
I agree.
And statistically, do you have any idea how many cases of ovarian cancer we're looking at per year?
Statistically, 1 in 71 women will be diagnosed, and this year in the United States, it'll be over 22,000 women, and over 14,000 women are estimated to die from ovarian cancer.
You know, I've always thought of ovarian cancer as being a sneaky kind of cancer. All cancers are sneaky. Most of them you don't know they're there.
Yeah.
You know. But ovarian cancer particularly, and why is that?
Ovarian cancer has been called the silent killer,
right.
But technically it whispers. But the thing is that the signs and the symptoms are so vague and so common. You know, it's things that women go through all the time.
Right.
You know, things that happen during a menstrual cycle, or you know, overeating. Something like that.
Tell us what some of the symptoms are.
Some of the symptoms include bloating, fatigue, back pain, abdominal and pelvic pain, pain with intercourse. So those are some of the symptoms. Urgency to urinate as well. So.
And that's probably because of the tumor pushing down on those organs. I was going to say just what we all have every day. Are there tests that they can do ahead of time that you know of?
There are no accurate tests to find ovarian cancer, and there's a huge misconception about what the Pap test detects,
right.
which is only cervical cancer. It does not detect ovarian cancer.
So a pelvic exam really does more good for detecting ovarian cancer than a Pap smear, which does no good at all.
Right.
Because they have an opportunity to feel.
They can find the if there's a tumor on the ovary or a cyst, but the only definite way is to actually have an open surgery to find the ovarian cancer, and because of that, it's often found in its late stages, which makes it one of the deadliest
right.
gynecological cancers that There is.
That's why I said it was sneaky,
Yeah.
because it is the way it is. Were you having these symptoms? What sent you to the doctor?
I went to the doctor in February of 2010, and I had abdominal pain and I had bloating. I had a very large tumor, but I was just told that I was overweight and that I needed to lose weight.
How long was it from the time that you went to the doctor until you got a definite diagnosis of ovarian cancer?
I went to the emergency room because I was in so much pain, and I wasn't diagnosed until about 6 months after the first time I went to the doctor.
That's a long time.
Yeah.
Really, to wait.
It is.
And this is not saying anything against doctors. I think that they do see a lot of women who have sort of generalized complaints, and it's easy to categorize people. And at your age, it's so unlikely that
Yeah.
probably wouldn't be something that they think of first, but still 6 months from your complaint.
I was trying to lose weight that whole time too, and it was going away other places, but my abdomen continued to be swollen.
Does heredity play a part in ovarian cancer?
It does play a part. Some of the risk factors include genetic predisposition, which is heredity. Also, if you have a family history of ovarian, breast, colon or rectum cancer, if you've never been pregnant, if you have long-term use of hormone treatments.
HRT,
Yeah.
hormone replacement
Yeah,
therapy?
those. And obesity is also a risk factor to increase your chances of developing ovarian cancer as well.
But still not this young. That's what I keep coming back to, it's not expected in your age group, really. So do you have a strong family history of cancer?
I do. On my mother's side, I've had, a lot of cancer on her side of the family, but not ovarian that I'm aware of.
That was going to be my next question. Anybody have ovarian cancer or female reproductive cancers? No. It may be like breast cancer. I mean, you don't necessarily have to have a family history.
Yeah.
It's just, one of those things that's happened. Now, how long have you been going through treatments for this?
It started I had surgery in August of 2010, and I did chemotherapy after that. And we thought we had gotten it all, and then actually I went for my 3-month checkup in August last year, and they found tumors in my abdominal wall.
So, and that's what you've been going through this round of, you just went through another round of chemo
And radiation. Mm-hmm.
It's, my heart goes out to you, having been through the chemo and radiation myself. I think until you have that you can't really understand what someone's going through, but it's harsh treatment. And how has it affected your personal life?
Personally, I feel like it's changed my opinion about life, kind of take the good with the bad.
Right.
And I've also decided that I want to be an advocate for ovarian cancer awareness, because a lot of women and some doctors, they don't know hardly anything about ovarian cancer at all.
I think that one thing right there, that you want to get out there and help other women and say, look, go. When you feel something that's not right in your body, follow through with it.
Yeah.
If you end up being the squeaky wheel, then be the squeaky wheel until you do get somebody to listen to you. Did you have a job? Were you working at the time? And has this affected your job?
The first time that I was diagnosed, I had surgery and I was out for 6 weeks, but I actually worked through chemo. This past time, the chemo was pretty intense, and I did step down from my position, and have been out of work since then. I'm hoping to go back in, the next few weeks. So.
Wonderful. I hope so. You brought some pictures, and Phil, if you'll put the pictures up on the screen, we'll get Danelle to tell us what they are, and then we'll come back and talk some more.
Okay. This is my best friend, Jeremy Bryant. He's a professor at Lynchburg College, and he's been a big support for me.
There are just some people who look really pretty without hair, and you're one of them. I just think your face is so pretty without it. Oops, sideways.
This was at a lung cancer awareness group, and my papa and my great uncle both passed away from lung cancer, and so I try to go to the different things at the cancer center when they have things like this. So, and I thought that was pretty.
A lot of these are sideways all of a sudden, but I do recognize that.
That is the radiation machine and the ceiling is very pretty. You have to lay flat on a table for radiation, and so they give you something nice to look at, I guess.
Yeah, there are 2 rooms, and they both have flowers and trees that look like you're looking out of a window, and it's restful if you've got to be there. Another pretty picture.
That's me with my bald head trying to be cute. This was the first time that I was doing chemo, and with Taxol, they had to give me basically a double, triple dose of Benadryl, which pretty much knocks me out. My mom liked taking a photo of me sleeping, and that was before I lost my hair. It was my first treatment. This is one of my girlfriends, Megan, and we're just being super silly.
You have to have a sense of humor.
Oh, yeah.
If you're going to get through anything like this.
Absolutely.
You just have to do it.
Yep. This is me for my last chemo treatment. And I decided to take a little picture with my teal wig.
It's a cool picture.
Thank you.
And I had to kick its ass again.
I did. You have to do it.
You have to have that attitude, you really do.
Last chemo. That is my port, which a lot of chemo patients have to get a port, and that is a direct access to the heart.
Right. And that's what they give your chemo drugs through.
And draw your blood as well.
Right. A lot of people have very bad veins, and having this access, they don't have to be stuck all the time. But you really have to dress around it.
Yeah. This is at the Relay for Life, and that is my grandma and my mom, and our team was the Teal Appeal that year.
And this was before your diagnosis?
This was after.
After? Okay.
Yes, ma'am. That's me and Mom, and that's our Teal Tuesday picture.
I'm going to get you to tell me about that in just a minute. Pretty picture.
That's my teal wig. I got that so I could have something different to wear on Teal Tuesday.
I think that's cool. Good pictures.
Thank you.
I think, like you told me once, that sometimes if you went to a party that you would put glitter on your head and go without a wig.
Yeah.
And I think that's cool. I think that's really sort of taking the whole situation in your own hands and doing something, kind of like fighting back and saying, this is not going to get to me.
Yep.
All right, go ahead and tell us about Teal Tuesday, and then we'll talk about the Relay for Life.
Okay. Teal Tuesday was a movement that started on Facebook. I'm not exactly sure who the girl is that started it. She lost her mom to ovarian cancer. But teal is the color for ovarian cancer awareness, just like pink is for breast cancer. But every Tuesday you're supposed to wear teal. And if someone comments about something that you're wearing that's teal, you explain to them why you're wearing it, and it kind of is a conversation starter, so you can tell people about ovarian cancer. And in the month of September, we're hopeful that every day we wear something teal during September.
Is Ovarian Cancer Awareness Month.
Yes, ma'am. So I'm hopeful to do that, but I'm trying to get as many people as possible to wear teal on Tuesdays. So
count me, and I'll wear teal on Tuesday.
Good.
All right, now tell me, are you involved with Relay for Life now?
I am. I have been in the past. My family has always gone to the event. Here recently, we have had a team as well. So
I imagine it's hard, really, or has been hard for you to get really involved and to go out and fundraise and that kind of stuff while you're going through these treatments.
Yeah, after this past surgery and the chemo being pretty rough this time, I haven't had much time to do it, but I am planning on having a team at the Lynchburg Relay this year. I'm not sure what I'm doing yet at the actual event, but I'll do something fun and raise a little bit of money. Every little bit helps. So,
when is the relay in Lynchburg this year? I did know, but I forgot.
It is on May 31st, and it's at the Heritage High School track.
And what do you have to do to get involved with that? Just show up?
If that's all you want to do, that's perfectly fine. You can come and spend some money and support the teams that are already there. You can go to relayforlife.org, and you can sign your own team up, or if you know somebody that has a team, you can join their team as well.
I think they do all sorts of fundraisers. Go out and canvass people and get donations and then auction those off. And I just think it's so great. The money that's raised here locally, I know that some of that stays here within the community.
The money that's raised at the relay goes to the American Cancer Society, which is the largest nonprofit organization that's funding cancer research. But locally, they provide programs like the Look Good, Feel Better program, which helps women who are having issues with appearance changes during chemo. They also help with lodging, getting rides to treatments, things like that, and it's really good.
People who are living by themselves and going through this without any family around, it is very difficult. It has to be, to get back and forth to treatments when you find yourself immediately sick.
Yeah.
The minute that you're up off that table.
Like radiation, you're going every day for that. So, for them to have programs that help get those patients to those treatments, that's really neat.
How many radiation treatments have you had?
I did 25.
25? People think it's just a little sunburn, but it's not. I mean, you start out with a little sunburn, but you can end up with blisters, and the whole process of radiation seems to make you exhausted. It really takes a lot out of you. So, anybody that who's going through this, I think it's really important to be supportive and to try to understand.
Absolutely.
Now, the Relay for Life is all night long. Why is that? I think it's interesting why that is.
Relay for Life goes all night because it is symbolic of how cancer never sleeps. And so you have to keep that fighting. We want to find a cure for cancer, and so because cancer never sleeps, neither can we.
Yeah, I just think that's a good way to look at it. And do you have any idea how much has been raised locally?
I'm not sure. Like I said, I've been really busy with treatments and things, so I'm not sure.
Okay, if somebody, you said go to relayforlife.org, if somebody was interested in getting part of this, getting involved with this, and I think it's such a good thing to get involved with, and you can get involved on any level. You can be part of a team, you can raise money, you can have, you all camp out overnight and sell stuff.
Yeah, people sell different things they've made, baked goods. They have games. They do opportunity drawings where you can win stuff. And usually, that stuff's donated, so all of that money goes to the American Cancer Society.
A friend of mine who lost his mother contacted me and wanted to know about Relay, and I'm telling him, pick up your grandchildren and go, because it's like a fair really for kids.
It is.
Because there are bouncy castles and bands and all kinds of stuff. There's something going on constantly.
Yep, all night.
And the food is great. And the last time we were at the Lynchburg one, there was a men's dressed as women.
Yeah, the men's pageant that
Yes.
they do. Which, if you think about that, is such a simple way to raise money. These guys are having so much fun dressed up, in their high heels. And they just go around and collect money. And, whoever collects the most wins the pageant. So
Yes, we saw them, and I thought, well, honey, you look really nice. But I think it's brave of them too, and a lot of family members will come out and do that when they have a family member who's involved with a cancer diagnosis. Are there any specific fundraisers geared for ovarian cancer?
The National Ovarian Cancer Coalition actually holds teal walks, which raise money just for their organization, but what they do is they promote ovarian cancer awareness and promote education for ovarian cancer awareness.
All right, so you told me that you were thinking or going to try to start a NOC and a National Ovarian Cancer Coalition group here in Lynchburg.
Mm-hmm.
What's involved with doing something like that?
Basically, I would just be helping to organize, walks or holding, conferences to let women know about, the disease. So,
Are there support groups as well?
for the ovarian cancer, none that I know of. I wish I could start one of those too, but I know there's some for breast cancer specifically, but
Yeah.
none for ovarian cancer that I've heard of around here.
I also know you write poetry, and you write,
Yes, ma'am.
is it short stories you write too, or just poetry?
Mostly poetry, and I do a little bit of nonfiction. I just dabble. Whatever goes on the paper is,
Some of what I've heard you read is really, really good.
Well, thank you.
And going through something like this, sometimes were you writing poetry before this happened to you?
Yeah.
I guess it can inspire you to write poetry about your experience.
Mm-hmm. I've written a few things about my journey, and some of the things I've posted at the Cancer Center, and some of my friends have actually written some things that we framed and put at the Cancer Center as well.
Danelle and I met each other. Well, we met each other at a restaurant, and then the next day we met each other at a writer's class at the Pearson Cancer Center that was offered for survivors and caregivers, which I thought was such a nice thing for them to do.
It was really neat. I've actually just recently attended an art class as well, which was really fun. We did some watercoloring and oil pastels.
Now, is that for survivors as well? I just think that it's so good. It's good to be doing something like that that's productive, but to be with a group of people who know exactly what you're going through.
Oh, yeah.
That's one of the things that I think walking in the Survivors Walk at Relay for Life is such an emotional thing, because you know that everybody who's walking along there with you knows exactly what you are going through.
Oh, yeah.
If you could say one thing to women who are listening or watching this show, anything, what would you tell them?
I would say to make sure to listen to your bodies. You know your body better than anyone else, and if you think something's wrong, then you need to go and find out what it is.
Right.
Like you said, be the squeaky wheel, and really go and find out what it is, because when cancer is caught early, whether it be ovarian, whether it be breast, your survival rate is instantly goes up if it's caught early. You know, they have ways of treating it if it's caught early, and so if you got to go and just.
You know, I'm sure that that women do this who have symptoms of ovarian cancer. There's so many women with breast cancer who are afraid to go and get a mammogram. And I'm sure there are people who are afraid to go and get an exam when they feel that something's wrong. But, you know, you just want to say, open your eyes, because this can really save your life.
Yeah. I mean, life is so worth it to go find out. It might be scary to go to the doctor at first, but you have to do it, and you have to, you know, fight every day.
You know, they told me when I was diagnosed, you're going to be jumping through hoops for a year. And yeah, you do jump through hoops.
Absolutely.
But you look at a year of your life stacked up against the rest of your life, then it gives you a different perspective, and you think, you know, it's worth it to go through this. And as difficult as it is losing your hair, but you look so pretty. But it's still difficult to do it. But it's not a bad exchange for your life, and your hair does grow back.
Absolutely.
Danelle, I thank you so much for being on this show. I hope you continue to do well. I just think you're awesome. And
thank you so much for having me. I'm so glad I got to come on and talk about ovarian cancer, and I hope that, you know, somebody out there is listening. And
right.
So
I always think that if something we say makes one woman go and saves a life, then what we did here tonight is really worth it.
Yeah, absolutely.
I thank you so much.
Thank you.
I hope you've enjoyed tonight's show, and if you have a moment, we'll try to get involved with Relay for Life. You can get involved on many levels. You can just go to the relay at Heritage High School on May 31st starting at 6 o'clock and buy some of the food, enjoy some of the concessions. It will be appreciated. My next show is going to be a little different. We're going to feature Daryl Laurent, who will be sitting in for me as guest host. Thank you so much for watching. Have a wonderful evening. Good night.